What I'm talking about is when a belief set around health and disease is used to manipulate your behavior and then takes you down a path of dependency in what we call the industrialized healthcare system. Thanks for listening. If you like the candid discussion and are seeking the truth behind the mainstream narrative, then please subscribe and share. Not only am I grateful, but those who seek the truth and wish to empower themselves and their family's health, freedoms, and future will also be grateful. All right, we're just going to roll because it's been a little while, and I am back, and it is December 7th of 2022, and I'm talking about bulging discs, prolapse discs, or herniated discs, and some of the connections behind them. This is an update from a couple-year-old, I believe, podcast episode where I shared a protocol, or at least alluded to the protocol, that I've used successfully with prolapsed, bulging, or herniated discs. And the first conversation you have to have with somebody that may understand this outside of the mainstream model of medicine, such as a neurosurgeon, an orthopedic surgeon, and this is not discrediting their knowledge and what they do. It's pretty fascinating and amazing what they can do at a surgical level. But what we're trying to talk about in terms of preventing is the need for those surgeries, multiple injections that dehydrate the joints and limit the body's ability to what's called imbibe or imbibition, which is the reabsorption of fluid back into the disc when you are not weight-bearing, so at night when you rest. The key here is that before we can just jump into the treatment of a bulging disc, because this is not standard treatment, and that's why I'm presenting it in a way that respects all these other theories and viewpoints on it. But I can only share with you where I've had success and why we come to that conclusion, how we come to that conclusion with a patient, but why it actually physiologically follows a cascade in the body. So first of all, you have to understand that the body has a stress cascade. When the body is under stress, there's a cascade of demand and supply, meaning, and again, this is taken for granted completely in the general population, especially, just in public. In society, you are just supposed to turn over all your health information and truth back to the doctor and let the doctor make decisions for you as to what you need to do to treat this condition. And this is the only way this condition gets treated. And this is how we do this treatment. This is how we do this. So yes, you feel a little sarcasm there, and I'm not trying to disparage. What I'm saying is that is the mainstream way, and I'm not ever going to be talking about things mainstream. And I realize that sadly in the last 2 years, because the things that I want to discuss with patients is a missing piece to their understanding of health. So if you have no basis for health other than how you feel, you will never truly have your health potential, period. And that may sound like a bold statement, but it's because with that belief set comes a behavior, and an outcome in that behavior is that you're relying on a medical model, allopathic medicine historically noted, to make those decisions for you. In other words, you've disempowered yourself to empower someone else and subjugate that right for that person to make a decision for you, okay? I'm not here making a decision for you. I'm here giving you options. I'm not always going to fit into your window of belief sets, that's for sure. In fact, I can guarantee it. Because if you're going to classify me in a political standpoint, you have no idea where I sit with both sides on certain aspects. But again, I don't care about the sides. I care about human beings. So the fact that I care about this country may make you think I'm a certain partisan belief set. while at the same time, as a human being, I have multifaceted viewpoints that take into account many different perspectives, but all support humanity as a whole, that we are endowed with the ability to care for ourselves once we hit a certain age, to understand that there's many ways to do this and there's many ways to approach it. What I'm presenting for you with this understanding of where disc bulges, disc prolapses, and disc herniations come from, you have to understand that the body first is a self-healing, self-regulating, and self-maintaining organism. Okay, that's a fact. You have the ability, the onboard ability, to create and express health. Now, you already have done it to some degree, all right? Otherwise, you wouldn't be listening to this. But you're either expressing your most optimal level of health, okay, and you're hitting your potential, or in most cases, we're not hitting our potential. Some of that comes from the lies we've been told, and this does not have anything to do with conspiracy theory. This has everything to do with factual information that's being disseminated by those that control the information and the disseminating channels. When that information is skewed towards a program of thought, then you are going to be limited in your ability to see things differently or outside of that programming thought. So to realize this, first, you have to realize that that does exist. It is a proven, well documented among many different schools of thought that exists. Okay, so first of all, information comes in, you get to see it. It trains, it taints, it filters the lens with which you see the world and you see yourself and others. To see things the way they truly are, you have to expand in what's possible. The quantum field has all possibility in it. Our limitations in this experience are very short and extremely biased. And I mean minor bias as well. I have a health bias. And that health bias sees the body as intelligent. That's a bias. Truly is. It could be factual, and I believe it is factual. But everything that I'm claiming comes from a premise that the body's intelligent, not stupid. That the body's dynamic. And that it's always changing. And it's self-healing, self-maintaining, and self-regulating. All that work is done through the nervous system. And we all have been endowed with what's called the divine spark. And this divine spark is what makes you unique to a machine, to a computer. The divine spark is a God-given, and this isn't religious, this is spiritual, a God-given, God-created organism that is given, endowed with, blessed with the ability to, again, self-regulate. What do I mean by self-regulate? Until you hear that a bit, that was like the third or fourth time I've said it. Until you hear that a bit, it doesn't sink in. Because you can tell me, oh, yeah, this is great. This is great information. Oh, yeah, self-regulate, blah, 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 blah. Nervous system controls it all. Yeah, master system, blah, blah, blah. Brain is smart. Brain runs it all. You can't gather and fathom, and I don't mean that derogatorily. I mean, it is awe-inspiring, and I work with this every day, all day. What the body's capable of doing is a magical dance. It seems like magic because we're supposed to not think that way. We're supposed to look, here's an example of that. We're supposed to look outside of the body for health. In other words, you can't defend yourself from pathogenic material or organisms. And again, even the word pathogenic, it sounds something you should be afraid of. Well, correct. It is supposed to make you afraid of something. If you're afraid of something, then you are manipulatable. Okay? You are malleable and moldable to the solution. But first, there has to be something to be afraid of. And if you're not afraid of something, well, then there's no reason to act any differently. But if there is something to be afraid of, now you're going to take up RAM in your body, your nervous system, and you are actually looking now for, if I have to worry about that thing, or if I have to be afraid of this thing, then I have to behave differently or act differently or get this thing or take something so I can be less afraid and defend myself from this bug outside or this nasty thing that could happen. Okay, so it doesn't mean that certain fears aren't warranted, such as, again, if you're sensing something and it's real and it saves your life, that's a healthy experience. What I'm talking about is when a belief set around health and disease is used to manipulate your behavior and then takes you down a path of dependency in what we call the industrialized healthcare system. In the industrialized healthcare system, many of you have already heard me say it many times. You've heard this term, or others share it throughout alternative means. But the bottom line is that this machine is designed to treat conditions, but it's also part of creating conditions. And I don't mean that individual doctors are malice. I've said this many, many times. Human beings in general are good, okay? And doctors that have gotten into the healthcare profession are by nature good with what they intend to do. But the system itself doesn't allow them to have individual choice to do their good. They're put through a series of standards, protocols by the system that they are part of, the hospital system. And that directs the doctor to basically just do what the protocol says on behalf of what the hospital's agenda or determination is. And that is a dark piece of information that many of you have become aware of more in the last 2 years. Others still may not want to buy into the possibility that exists because it's too daunting. And I get that too, but the reality is what it is because I get to see it every day. That system is designed so that once you enter it, you really can't get out. There's no out. They're not going to refer you to an alternative healthcare provider. They're going to keep you in their system, period. Again, that's not what this is about, but the premise as to what happens with disc and how your body heals, that is part of a foundation that you have to be aware of that is broken, because if you go with a herniated disc or a bulged disc or a prolapse disc or even disc degeneration, the medical alternatives for that are injections with corticosteroids, surgery, physical therapy, more exercise, more movement on this quote-unquote broken, damaged, injured area, inflamed area. And so the goal is to reduce the inflammation through a drug, but not change a dietary habit that actually is in a downward effectual cascade to the symptoms I just described. You are made of connective tissue, many, many different types of cells in the body. Without getting into all those cells in the minutia, here's what you need to take away from, and my goal is for you to take this away from this podcast, from this episode, this conversation, and that is a patient, again, and this happens almost weekly, if not weekly, like clockwork. Doctor said I had a bulged disc. Doctor said I had a herniated disc. I have disc degeneration. What is DDD? What is DJD? DDD is degenerative disc disease. DJD is degenerative joint disease. Both are pretty much the same thing. It's just where it happens. Both can happen at the same time. You can have one more than the other. Just know they're pretty close to the same process. And the process is, first of all, just like your car, if you don't keep the joints lubed, then you're going to wear parts out. They're going to squeak and they're going to break down. If your tires are malaligned and you drive from here, which is Midwest, or you drive coast to coast, let's just say from East Coast to West Coast, you're going to go through those tires much faster than you were if the tires were aligned and balanced. Okay? That is wear and tear that's abnormal based on the mileage. So back to your body. Abnormal wear and tear on the body is sped up. So in other words, your biological, your tissue age starts to exceed your chronological, your actual age, by way of your body breaking down prematurely. So that happens, we were taught in chemistry that there's entropy, okay, and that is the natural dissociation of things over time. This is what's fascinating. I don't see that like that anymore. I realize where that line of thinking came from. Do I think entropy exists? Heck yes, I do. Of course it does. Is it a way to think of everything in the world? No, it is not. And I'll tell you why. Because what seems to be a disorganizing piece of anatomy or structure, let's just say a plant or a stone even, as we see that stone breaking down, that is simply part of the process. What I call it breaking down is where entropy comes in. What is actually happening in the bigger picture, beyond my experience, beyond my vocabulary, my ability to place terminology and words and logic to it, it appears to be breaking down to me. But beyond my experience, if I open up my ability to see the big picture beyond me and what I've been taught or programmed, however you want to look at it, I could see this as a bigger picture where it's actually feeding and growing into something else, where it's supporting the growth of something else, where it's actually not breaking down, maybe breaking up, maybe not dissociating, maybe reassociating. So all I'm saying there with you is I always have to be open to taking new information in and challenging my own previous beliefs. So when you have an injury and you think, hey, I sprained my ankle, or this particular gal was lifting weights, she's done it for 30 plus, maybe 40 years, and she's a professional, and she has a bulged disc in her neck. So the question was, hey, what happened? Maybe you could help me out, take a look at this. And I'm like, well, I started asking her questions. Instead of giving answers, I just asked questions. Okay. Aside from some of the information I'm missing, I have 3 questions for you. 1, first of all, where's the disc bulge? Okay, in the neck. All right, and we know where it's more prominent, between C5 and C6 for whiplash type injuries. There was a history of trauma in the past when she was younger, but that was all cleared up, arguably. And again, this was over 30 years ago. So then we look at other factors. If there's a bulging disc and there's no specific trauma because she didn't have a new trauma, she had an exacerbation. Well, what created the exacerbation? What created the aggravation? Well, on my lazy day, I would just say, who cares what created it? Let's just get you adjusted. Well, sadly, I'm not lazy today, so I asked the question. The new Thera 360, featuring TheraFusion infrared technology, has completely revolutionized personal health products with its patented infrared personal portable sauna. Featuring our proprietary, exclusive natural earth element, full-spectrum infrared heating panels created with tourmaline gemstones to generate an abundance of negative ions, bathe your body from every angle in gentle, full-spectrum infrared frequencies and negative ions, and to no exposure to you from harmful EMFs, ELFs, and RFs. Therasage 360's revolutionary advanced earthing technology further enhances the healing experience by capturing the charge of the earth to help balance the delicate polarity of the body and improve cellular communication. The unique method to shield harmful EMFs, ELFs, and RFs allows the body to absorb the maximum healing benefits of the Thera 360 infrared sauna. The Full Spectrum Sauna is the only portable sauna that offers full spectrum infrared, negative ions, earthing, and no EMFs at an affordable price for everyone in the world to embrace optimal health, and stores in a closet or under your bed, easily folding up. Use code FSDW360 for a 15% discount today. You'll be glad you did. Tell me how you've been doing digestively, where your stress has been at, and tell me exactly what you were doing that seemed to precipitate or become before this neck pain, compression feeling, and upper shoulder soreness that came out of this. What precipitated it? What was before? What may I ask could help bring this on? And then lastly, I had to say, you're not digesting. Before this, I said, how have you been doing with your levels of protein, the hormonal balance, and overall inflammation? Because all this ties in to what you're asking me to look at. And the patient said, okay, well, and started to answer the questions and said, and we were doing this back and forth through video text. She hopped on and sent me a video, and it was, well, I did have an injury, a whiplash injury when I was younger, a teenager, and so that could be part of the problem. I'm like, yep, it could be part of the history, but why currently did it decide to act up right now? 2, digestion's been better. Hormones have been still a little erratic, but overall, really good. This woman's not overweight, okay? She's very physically fit, strong, and again, works out regularly. So why did a workout create a bulge disc when she wasn't working her neck out, okay? She was working her body out. And the last thing was thinking digestion's good. But yes, around the holidays, things have gotten a little off, but not majorly. So doing pretty good, like 80-20. 80% of the time she's on target, eating really clean organic food. Other times, 20% not. But not crazy off when she is off. All right, great. So the next answer from her pretty much nailed it for me in terms of what I can do. So why am I belaboring this point? Because it's so misunderstood. My response back to her was, if your body replenishes, repairs, and maintains itself with adequate levels of protein, that means she inherently has the ability to regulate discal pressure, regulate the integrity of the connective tissue, regulate the level of inflammation in the body by way of proteins, by way of cytokines, which are proteins, create enzymes for breaking waste down, white blood cells, immune response, protein requirement to address pathogens in the body, inflammatories, or in other words, inflammatory metabolic waste, and basically hone in on exactly what the body needs, when it needs it, how it needs it, in the quantities it needs it. And when this doesn't happen, my questions, when I look at this holistically and understanding the role enzymes play and where inflammation is, and understanding, more importantly, metabolic, physiologic cascades. Protein is the cascade to disc injuries and connective tissue injuries. All right? So when I responded back to this individual and said, look, I'm not there. I would love to put my hands on the area, test your body physically with an exam, and determine where your stress points are that tell me where the body is struggling to break down and assimilate nutrients. Whether your macronutrients, carbs, proteins, or fats, or a combination thereof, are not being ingested, digested, and assimilated, which will tell me what cascade ends up to be a deficiency syndrome. So stress, the stress cascade, creates a deficit in the body when we don't properly nutrify the body. So instead of me making this about you're missing this nutrient, you're missing that nutrient, my whole point for trying to empower you and share with you how to understand this is your body needs macronutrients first. Okay, it's not as just easy as, oh, I eat meat, I eat protein, oh, I eat plenty. How do you know? I don't know. I'm not saying you're not. I'm saying if you express with this type of condition, I know where your body started to have a weakness. The nuance is to be able to address exactly where that breakdown occurred in your unique way, because you're an individual, and then help support your body to replenish itself in a way that addresses the cascade at the top. In other words, upstream, we continue to say upstream, because we're not going to treat a problem in Louisiana in the same river that we could, we're treating the water down in Louisiana, southern United States, when we actually can get towards the headwaters of that river and impact every every town all the way down to Louisiana, down to the ocean. That is treating something upstream and correcting a problem correcting a problem that is below by correcting it upstream and affecting everything downstream. So the DISC protocol that I use has worked tremendously well. It's worked awesome, in fact. And why does it work? Well, it's prescribed on an individual basis, number one. Number two, I do need a full context of the patient's story. I need a full context of what happened to determine where there was a breakdown. Can fats affect this? Of course they can. They can affect another thing that affects this other thing. Can carbohydrates? Certainly can. But it comes back to understanding the role that each one of those macronutrients plays in the systems that it'll affect downstream. So, for example, the stress cascade hits the thyroid, which is a gland. It depletes essential fatty acid stores, which then ultimately weakens your cellular flexibility, which can affect your immune system. It can affect your hormones. It can affect your brain function, your depression, your anxiety. It can affect the respiratory system. So you might present with a lung problem, a shoulder problem. You might present with weakness and fatigue and think it's an iron problem when really it's an imbalance with your macronutrients, among other things. But it could create micronutrient deficiencies as a result. But if you keep just addressing the micronutrient symptoms, you may never get to what's causing it and just get good results by treating the micronutrients, but never really correct the problem. And so that's where we come back to, those are just examples in that if you realize the connective tissue is what a disc is made of, okay? We can treat the disc with care, with adjustments, with electric stim, with ultrasound, with cold laser, with, different deep tissue therapies and techniques that, whether it's blades, whether it's hands, and we could do all kinds of things, all right? Modalities we can ice, we can heat, and those may have a bearing, but how many things do you need to do? That's up to you. I would think there's cases that warrant many of those tools, but every case does not warrant all those tools at all the time. I certainly could say that. What I want to do with a patient is empower them. I want to get them through the scenario as quickly as possible, but on their terms, which is, I have referred patients with disc herniations. Quite frankly, there's a gentleman I can think of specifically, and I said, if you really don't have the patience for this, I get it. You need to go see an orthopedic surgeon then. That's it. We're done. That's okay. And I did it extremely politely. He was a friend, and I'd seen him before for other things, and he had this injury, and as a musician, his head was down a lot. So he created this problem, and I knew you're either in it for the long haul to correct it, and you have to be okay with that, and you're going to be patient enough because you want to do the right thing for your body, or you really don't care about the effect of a surgery down the road. You just want out of pain now. Well, then that's your best route. Okay? That's me working for the patient. This is either right for you or it's not. Why I think it's right for many if they understand it, why it's right for everyone when they understand it, but it's not if you don't, okay, period, is that you can either buy into the fact that you are a machine and need to be fixed and you go in and repair yourself and then you go back to doing the same thing that caused it. Doesn't sound very intelligent to me, but we are human beings, and it's not up to me whether you do what I like or not. That's not the point. The point is whether you do what you like and whether you actually realize you have choices. That's where this comes in, is whether you realize you have choices. So if you realize you have some choices, great. This could be it for you. Or direction, something like this. But if you don't know it exists, then you're just going to do whatever your medical doctor says. Period. Done. The industrialized machine will either surgically, conditionally remove something or repair something. And that's it. Drugs or surgery, period. No corrective empowerment. No, don't change your diet when you get your gallbladder taken out. Just Keep doing what you did to get here. Oh, it was just bad luck. That's not intelligent by any stretch of the imagination. There's no intelligence involved in saying you just have bad luck. I could have said I had bad luck with a genetic condition or with, when cancer strikes, but I didn't. Why? I have no special skill set as a human being other than curiosity and a desire and a vision that human beings are incredible. That's it. No special powers, just hard work. My share with you today is this gal, her disc will heal whether she does what I tell her or not. The difference is going to be how well it heals and whether she deals with a lifelong problem or she puts this behind her. That is the value of what I'm offering my patients. The choice to improve and grow through their journey of struggle and health challenges that are there to teach them how they are part of their whole experience. Not, I get to do whatever I want haphazardly, and I just go into the repair shop, they fix me, and I jump back out on the road and beat the hell out of my body again. You can absolutely do that, but you will struggle more than you need. You'll have unnecessary struggle. It's complete irresponsibility versus accountability and responsibility. It takes away your ability to be able to respond. Self-correct. You're missing your own power. So, again, I don't need to be right. I just need to be great at what I do, fair to the people I serve, and allow choices, and allow you a chance, the person in front of me, a chance to choose if it's right to take this route or a different route. And there's no judgment either way. You get to do that. And when you hear me sarcastically or facetiously speak, the gentleman that got surgery, that was the right path for him. And as long as he knew all those consequences, that's cool. And even if he didn't know the consequences, that's on him. That's on him to ask the questions. Like, okay, doc, you're going to get rid of this pain with the surgery. That sounds awesome. So how long is my recovery? Because I like to play. And does that mean I have any limitations down the road? If he's okay with those and he's asked those questions and he has no more questions, so be it. Awesome. Go for it. But this particular gal does not want surgery. This gal wants to stay active. She wants to continue to work out, be fit, enjoy her life, be able to have options to choose to move and have freedom and not live in pain. And it supports her philosophy towards health, which is first, do whatever you can conservatively and naturally. Drugs last, and surgical intervention last. And of course, if you watch, social media and marketing, and you watch TV at all, advertising, you're going to see that that's not the first choice. The first choice, the little guy, the little marketing ads are going to be the local that are giving you options towards health, whether it be a chiropractor, nutritionist, or something in your area. But the big dollars are on pushing drugs and major medical systems. So, again, I'm not here to pitch a mainstream message. That's not what I do. It's not that I'm against mainstream. It's that I just won't be mainstream when I actually go to bat for the individual patient, not the mass. And the mainstream has to move the mass. Okay, anyway, you don't need a reintegration of that, but get the benefit of full spectrum infrared sauna in the comfort of your own home. Help your body fight inflammation, burn calories up to 600 calories per session, increase metabolism and circulation, detoxify, soothe muscle pain, enhance your skin's appearance, and support a more relaxed state and better sleep. Try the Therasage 360. You'll be glad you did. Use code FSDW360 for a 15% discount today. The key here with correcting a bulging disc is to improve protein digestion. That's ultimately the answer. And ultimately getting enough protein into the system until you can catch up, get the digestive system and absorption with less inflammation going, so the body can. I mean, there's a direction. Number one, treat the immediate thing, which is get protein in the system in a way that's pre-digested that the body can use. Break things down appropriately, support the healing of the digestive system in the gut, and then reduce any inflammatory foods that are going to continue to perpetuate higher levels of inflammation in the body. That formula, when done correctly, yields fantastic results because, again, the life force within the body, and with chiropractic care at the same time, these people get better the fastest, in my opinion. But that's what I've seen as well, and my patients respond back. And I can give you several other cases, and I think I have in the past. I've given a couple different scenarios of real extreme cases is why I'm referring. I mean, I could give you easily a couple dozen cases over the years that were specifically disc related that we dealt with in this specific manner. And the outcomes were shockingly good for the patient and not that surprising for me. My first ones were pretty shocking, but that's when this started to come and it made a lot more sense. And that's my job, is to do it, help people in a way that's drug-free and empower them to become their own best advocate for their own health and teach them where they get to make choices. And that's why this isn't mainstream, because you feel like your choices are being taken away, which is true. So again, suppression of a message of empowerment is wrong. Censorship of a message of empowerment is wrong. Sharing information in a way that you can take it or leave it, what is wrong with that, especially when it's a choice and there's no promises other than that your body has a healing potential. The rest is, what state are you in? How far has this gotten? Is it something that can be turned around or at least improved? Or do you need something more invasive? And that's, again, why you want to find somebody or attract a healthcare provider that sees the big picture like that and realizes, again, there's no ego. You don't have to be right. You just have to do right by the patient. I don't accept every patient. I mean, the quickest way to not pass, or for me to not accept you as a patient, is to really not be committed to what I'm going to present. And you get to hear that first and then decide. But I'm going to be real with you, and patients of mine know that, and I won't hold any punches. Meaning, you're going to have an idea what's expected, and it's a partnership in terms of how we move forward. It's not me fixing you and you get to do nothing. It's how, if you want to get well, I'm committed to taking you this route, but this is what it looks like, and this is what we call a good faith estimate. You're going to get an idea what that costs. And so then you can wrap your head around it and go, all right, now some cases are quicker and some are slower, and it just depends. But at least we're going to look at that and build that in, and you're going to have dialogue along the way that lets you know where you are on that path, whether it's faster or slower. And then you get choices along there too. But again, this is nothing crazy weird when all your healthcare providers should really have this option with you. It's just that you're not used to it with medicine because they don't operate that way. You're not supposed to have choices in the medical model. The doctor makes a decision, you follow that order, period, done. And if not, you are non-compliant. So what? Be non-compliant if you want, whatever. But, and I don't mean that disrespectfully. It just means, are you forgetting that you have a choice in the matter? Well, how about being reminded of that? Stand up for yourself. Stand up for your own rights. Stand up for your choices. So there are many ways to address herniated, bulging, and prolapsed discs. Number one, it's going to heal regardless. It just takes time. Within 90 days to 6 months, that disc will be healed, all right, whether you do nothing or something. But the caveat is, if you do nothing, you're probably going to you are going to heal with more scar tissue than if you were to work on some corrective measures and actually getting to the cause of why that herniated in the first place. And I guarantee you this is an experiential clinical pearl. Most disc bulges and herniations are non-traumatic in nature, which means they didn't come from a direct car accident or compressing the head. Some do, of course, that's the case. But most the higher percentage come from chronic, repetitive, imbalanced use and unhealthy digestion and dietary ingestion of foods or non-foods that actually create connective tissue weakness or deficiencies, and that allows for the bulging and prolapsing of your connective tissues, the weakening of it. It also leads to strains and sprains more frequently, and ultimately the inability to hold alignment, which is your structure, which is many of you complain of, which is, why can't I hold alignment? How can I hold alignment longer? So these are all parts of a similar scenario, not solely, but they're all connected to whether you're balanced, which does come from your ability to properly digest and assimilate carbs, proteins, and fats. And then what you do with it, how you're living your life along the way, physically, spiritually, emotionally, and the stressors that are either putting a greater demand on those needs, which tighten the reins even more, or you're really good at those areas and you're expressing a great degree of health. Then we can guarantee that you're digesting carbs, proteins, and fats pretty well, or you're managing your physical and emotional and chemical stress extremely well. And those are the healthier people on the planet. Period. Well, I hope this helps. These outer ring areas do influence what we talked about with the disc and where your philosophy comes from, and how you get to either get funneled into whatever your doctors say in your region, wherever that is. Whoever you see is going to influence that. Now, that's why you see them in the first place, but many of you feel like that's all you have. Like, this is it because they're in my plan. No, you can go outside your plan. You just may not be able to afford everything, and you may not feel like you can afford it. But, I mean, we're talking about your health, so you're either going to have this care by default, which is not by your choice, or which means you don't get a lot of choices, or you go outside the system and you find somebody that actually aligns with your goals and your philosophies and how you want to take care of your body and how the experience you want to have with your health. That's why it's important to be part of you choosing who your healthcare providers are. So remember, disc injuries and weak connective tissue ties back into protein digestion, assimilation, and or protein deficiencies. And I will qualify one piece here. The gal I was talking about specifically with this disc bulge does eat a fair amount of protein. So then many of you might say, so if I just go home and eat more protein, well, that would be a start. But some of you are already eating a fair amount, if not a lot of protein. And then you have to look at the types of proteins. For example, weightlifters and weight trainers are recommended to take whey protein because it's the best protein out there. Well, welcome to a lot of haters on this one, because I too used to use whey protein, and then we talk about isolate versus concentrate. And yes, concentrate is better because it's more of a whole version, but it's still dairy, and dairy is not great for all blood types. And so you have to be able to digest the actual whey protein. So if you've noticed, like many cases, there's more bloat with the whey protein. And there's additives that they put in there to then help reduce that bloat and break it down. Well, again, we're talking about the individual here. I don't want to make a blanket statement and say all whey protein is bad. What I want to ask you is, if you're using it, do you notice the bloat, and are you still inflamed, and are you meeting your health goals? If you are, fantastic. If you're not, you can still have a great deal of protein going in your body and still end up with what this woman did, because that's actually this case. There was a fair amount of protein going in, but the digestion assimilation was weak, and her tissues are what's telling us that. Okay, so the outcome is this is what happens in the body, but when it's not, we know where to look. We're not just treating the disc, we're saying, interesting. That just doesn't happen for no reason. And alignment's one thing, but she was getting adjusted, so that's not really the issue. We're back to physiology. All right, so again, I don't want to beat a dead horse, but there's so many questions that people have out of this after a couple a couple comments like I just made, and that means, oh, more protein. Well, no, that's not the case. Just like a woman this morning, is the fact that, I'll preface it, is that bilateral upper back shoulder tension, and it's become more chronic and noticeable. Well, a high-fat diet. She had been doing keto. Well, keto's not bad at all, but you have to be able to digest the fats and assimilate the fats into the system. And when you're not, you're going to be essential fatty acid deficient. So in her head, she's like, I'm already eating a lot of fats. Yeah, I'm like, don't go home and eat more. You're already doing a lot. What we have to do is improve the digestion of your essential fatty acids to get them into the system so your body can replenish the high demand that you've taken on it with the family stress you've been under and the health stress she's been under. So again, just another example that it's not all just cookbookery where, oh, I have this symptom, you take this. I have that symptom. That's the new wave of functional med. I'm a proponent of functional med, but not the cookbook that says I'm going to treat a condition and instead of a drug, I'm going to use nutrition. We're still treating a condition, not causes of the condition, if that makes sense. We don't treat labs, we treat human beings. That's the difference. I'll look at a lab to determine how the system metabolically and the overall picture is working. Yes, you can find nuances with certain levels that are dropped or raised or whatever and look for problems. And we do look at it that way, but we're also going to step back and say, all right, where's the patient come into this mix? Now let's treat the patient and what's important to them while we're correcting the causes so that the patient A starts winning, physically feeling better, doing better, and you're not just covering something up while something else is able to get worse. Again, why is that so different? It shouldn't be different. It just seems to be different. That's what my patients are telling me. So that said, I think I've said enough this episode. It's good to be back. I'm going to be releasing another podcast. That's what I've been working most on. It's been literally 4 months almost since I've published. It's been like just shy of 16 weeks. I've been working on some other things such as our website, getting that done, but I shifted focus. Plus, I'm releasing another podcast, and I'm excited for that. It's going to be a broader scope, but it's going to bring back the fundamentals that we keep talking about. But I want to do it in a way where people can get a handle on the actual, truly to empower people, in my opinion, is going to be helping them shift their perspective back into what they're gifted with already instead of fearing more. So it's going to be about reducing fear by empowering people on where their strengths are and how to use those strengths to their advantage, how to build their strengths. So I'm excited about that. I will let you know more details as that comes up. But until next time, peace and love. Ciao. Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share, so more of our brothers and sisters can grow to realize their voice and their health freedom. Speaking up means you matter, so get on it. This podcast is for information purposes only. The statements or views expressed are not medical advice and are not meant to replace the advice of your medical doctor. This podcast, including Dr. Wade Anderson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or products. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical condition, consult your licensed physician.